Hello viewers, I'd like to welcome you to this special launch edition of Perspectives. My name is Adedoyin. I'll be your host for this program. And today we're looking into a matter of life and death. We're talking about healthcare. We want to understand the role that ICT plays in facilitating healthcare across Africa. As you will probably agree, Africa lags behind in healthcare provision globally. We cannot today be regarded as a healthy continent. The statistics show that healthcare in Africa lags behind even the poor developing countries in Southeast Asia, South Asia, and so on. And the gap seems to have broadened over the past few years. So to discuss this very topical issue with me today is an expert and somebody whose life's work has focused on improving healthcare in Nigeria, and who is also keenly interested in the application of information technology. My guest today is Fola Laoye. Welcome, Fola. Thank you for finding time out of your extremely busy schedule to share with us today. Fola Laoye is currently the chairperson of Hygeia Group after several years as its managing director and chief executive officer. The Hygeia Group consists of Lagoon Hospitals and the Hygeia HMOs, one of the leading quality providers of healthcare in Nigeria. So Fola, thank you once again. It's nice to have you on the show.
Thanks, Dewey. Nice to be here.
Clearly, ICT is becoming increasingly pervasive. I know that you're keenly interested, passionate about IT indeed.
Sure.
And we know there are many applications of ICT in medicine.
Absolutely.
Some of them may be less obvious, but I want you to just start by explaining to us those ones that you think are the most impactful. You know, what areas can IT really impact healthcare across Africa today?
Sure. So thanks a lot, Dewey, for that introduction. And hello, viewers. I think, when we talk about the issue of health, as Dewey rightly put it, obviously we know that we have a challenge on our hands. That's the first thing we have to identify. We have a challenge in terms of, where healthcare is available versus where people live. So there's a challenge of real physical access. And then, of course, there's a challenge of what I would call financial access. What can people afford? And I think financial access particularly has become a bigger issue, especially with more and more of healthcare being what I would call privately driven, in a more commercial model. But if I sort of start first with the issue of physical access, with the way Africa, has grown, certainly with such a large population, but still with a very big divide, I would say, between rural and urban populations. That has become more and more of a challenge in terms of delivering care. And I think in that regard, healthcare is not alone. I think that has also become a challenge for many other services as well to be delivered to the population of Africans. But maybe it's a bit more significant from a healthcare point of view, because healthcare is something that the entire population needs.
Absolutely.
And if they always say a healthy nation is a wealthy nation. So even if you have a few people healthy and the rest not, it tends to impact your economic development and so on. So I think IT particularly has started to play a role in how to bridge that gap in terms of physical access. And there's quite a bit of work going on now in the areas of what is known as mHealth, mobile health, whereby people who are in more remote areas are able to have access to, one, health information, and two, health providers, even when necessary, through mobile phone technology, and through internet enabled access. So that, and especially given that in our part of the world, again, the number of actual health professionals are still not quite, of the right ratio to the population. it's been a way of being able to extend the reach of these professionals to a larger population. I have to say that in this regard, I think East Africa is moving a little faster than we are in West Africa, and especially in Nigeria, in terms of really being able to use mobile technology to enhance this. But it has become now, something that is getting more established, and we are, obviously watching that and trying to see how we bring that in. Some of the phone telcos you may know, for instance, an MTN has started a mobile health service whereby, they are also beginning to disseminate and pass through a lot of health information, through text messaging and so on, which actually is extremely timely. Also because we are now really sort of going through what we call the growth of the lifestyle diseases, hypertension, diabetes, things that people can do something about if they are better informed and are able to take action. So I think that's one very significant area where ICT, is making an intervention. Okay. I think another is when we talk about financial access. Again, this is something that is been more heavily piloted in East Africa, but again, we are looking at it very closely. It's what you call, right now, most countries are building their health insurance platforms, because health insurance really is the key way of financing healthcare. But again, the reach is difficult. How do you reach the populations in remote areas? How do you get them enrolled and so on? But again, we found that through the type of M-Pesa type programs in East Africa, where you are now seeing more mobile money and more use of mobile payment systems, that is also enabling the population to buy health insurance, and extend reach. So I think that too is something that we feel very excited about here, and we're already beginning to do some piloting to see how that can be rolled out.
Okay, that's very interesting. You've established a link between the mobile money and medicine. You've established a link between some of the things that are going on in other parts of Africa with telecoms companies. What about telemedicine though? Because we hear that that's going on globally. Is that taking off in Africa?
It is, but I think again, because, and this may shift slightly, like we said, it's obviously all dependent on the level of access to data, and to internet, the level of internet connectivity. Because the mobile telephony, has been the first wave.
Yes.
That's why the use of text messaging and so on has been easier to deploy. Yes. But now with the sort of level of aggressive data service rollout across the country, and obviously the fact that, again, people can afford more and more smartphones, we know that that is going to become a reality, where you can really use telemedicine more effectively. And as I mentioned before, you can have a more interactive health professional and health consumer relationship, because then they can actually see each other if necessary and so on. But yes, so it is being used in certain pockets, especially particularly being used in pockets of care where there are fewer and fewer professionals in the country, and the professionals are sitting in other countries. So people are availing themselves of that opportunity of consulting with professionals abroad. But we think that there can be, a much wider use in country.
What then are the challenges in trying to adopt and apply all these technologies to medical care?
I think it's really just, first of all, the level to which healthcare itself and healthcare processes themselves become automated. Right now, we are living in a very manually driven world. I'll give you an example. Recently, in our hospitals, we took on the project of adopting electronic medical records, which is now to totally digitize our medical records, so that whenever a customer comes in to any of our facilities around Lagos, they are sort of queued in a digital world, and their records, their information, their medical history is readily available. Doesn't matter which location you visit. But that's a challenge in itself. First of all, we had to put on something like 2 million records, that were paper records into the digital space. We also had to put in something like 1 million x-rays and, and different pictures onto the system. So that's still an issue where, people are still dealing very much with manual data. And how do you do that? But then the issue then becomes, we are still very much in an island because there are only very few facilities like us who have gone into that mode. So it means the sort of transferability of information and so on that you need to really extend reach is not yet fully
limited.
Is still limited to the fact that the data is still sitting in different places in the manual form. So I think there's also a bit of a psychology to it where you need to sort of create a bit of a change, and for people to be able to sort of adopt the use of ICT, and people to be really familiar with using ICT and be ready to live in that world, because of course it's a very different world. Absolutely. Our doctors now cannot write anything on paper. They must be able to type in their notes quickly enough not to create a bottleneck in the system, and so on. So of course that it's a bit of a mindset change as well.
Okay, that's interesting. So there are success stories. You've just given us the example of some of your hospitals.
Sure.
Can you give us any other examples where technology has been applied successfully across Africa?
I think certainly there's a whole issue of what I'll call business processing. Just like in any other business, healthcare is no exception. So you have to remember that every time a patient, sees a doctor, there are 5 or 6, sometimes 7 transactions happen. The diagnosis has to be made, so sometimes it means a lab test or an x-ray taken, a prescription, drugs have to be, dispensed and so on. And therefore, behind what you see as an intervention, there is quite a lot of processing that takes place. A case in point now, for instance, is if I look at our national health insurance platform, we now have about 5 to 6 million people insured, which again is still a small number
compared to our population.
Absolutely. But if you magnify that straight away tells you, how many transactions, you're talking about. 5 or 6 million people, if they go to the hospital 5 times a year, that's 30 million visits, which is easily 150 million records. So that's the scale of what is required. And you find that, yes, again, with health insurance, it's getting easier to understand that scale and to start to plan for, electronic platforms to support that scale. So, for instance, the National Health Insurance Scheme in Nigeria is currently undergoing a lot of work to create what is called an eNHIS platform, so that at least that way there is a data exchange now for the customer, for the provider, for the payer, and so on. So some of these things will really revolutionize the way, healthcare is being delivered, how it's being processed, and so on. But there are also other opportunities where there is a fair amount of outsourcing, of business processes now coming up around Africa, and certainly I can certainly see them being applied again to the healthcare space.
Interesting. My final question will be, what does the future hold? You've given us this picture of pockets of ICT application across Africa. Some of them seem very interesting, but we know that there are challenges, whether they're infrastructural challenges or awareness challenges or even change management challenges. To what extent do you see these challenges inhibiting the potential? To what extent do you see the potential overtaking the challenges? What picture of the future do you want to leave with us today?
Well, I certainly think that, given the way I'll call almost the race of ICT across Africa, if you look at where we are now, sort of in the last 10 years, especially with mobile telephony coming in and mobile telephony, creating access, I think everybody is much more aware. Everybody is much more technologically enabled, if I can call it that, because everybody walks around with a phone or some kind of device that you can now. So I think that's an extremely powerful opportunity that we're sitting on. Yes, there are challenges. How do we really make the most of it, especially in an integrated fashion, as you said, because it's one thing to have pockets, but it's one thing for it to all link up into one sort of central hub. Now, that is by no means an easy feat. If you look at developed countries, even the UK, the US, it's taking them, years and years and years to even begin to get there. But in a way, I suspect that we'll be able to leapfrog, because again, we'll be able to learn from their own process and how they've had to do it. We've obviously adopted an ICT technology platform that's universal across the world, so it's going to be much easier to transfer, whatever have been the successes, to really help us integrate. So I think it's early days, yes, but I certainly think that the level of adoption will be pretty fast, especially once the issue of reach, has been adequately tackled. I think we'll find that, once more people are brought into the system, that's obviously going to, spearhead that. But I think one thing that will be important, though, is that as medical professionals, it's now ingrained in their training, almost from the get-go of the use of technology. Because of course, even though I've described how the use of technology drives their the processes and so on, it also drives today the actual treatment, actual sort of healthcare delivery, whether it is through radiology, x-rays and so on. Everything is in a digital realm now. And therefore, it's going to be important that healthcare professionals who are being trained up, in today's world, do so with that mindset, because that obviously will also help to really improve and increase the adoption of ICT.
Okay, great. We've been talking to Fola Laoye, the chairperson, Hygieia Group. Fola is an accountant by profession, a healthcare executive by experience, and a technology lover. She's given us great insights today into how ICT can facilitate healthcare across Africa. She's given us very instructive points and linked together the developments around the mobile technology, around the adoption of payments, electronic payments, and all of that, along with the key tenets of healthcare. So I'm sure you've enjoyed this program as much as I have. We look forward to speaking with you again next time. Fola, thank you so much for coming.
Thanks.
It's been very interesting. Thank you. God bless.